Hello, welcome everyone, and thank you to those joining us live and to those listening in afterwards. I'd also like to warmly welcome our guests today, whom I'll shortly introduce. Our webinar for today is the role of pharmacists in the prevention and management of sleep disorders. I think it's a very important topic that has a big impact in the patients that we serve. Sleep is a basic human need and it is essential for optimal health and well-being. However, lifestyle and environmental factors are increasingly causing sleep disturbances, or sleep disorders. The negative effects of sleep deprivation include physical effects, for example, sleepiness and fatigue, decline in cognitive function, for example, diminishment of mental concentration and performance, increasing the risks of accidents and injuries, and mental health complications, for example, increasing feelings of irritability, anxiety, sadness, and anger, and also difficulty to manage stress. Sleep deprivation also increases the risk of chronic illnesses. Pharmacists can play a role in managing and supporting people in dealing with sleep disorders through pharmacological and non-pharmacological approaches. And it is a very frequent topic that we are asked about when working in our pharmacies. Our speakers will explore this in further detail in this webinar. But first, let me introduce myself. My name is Jaime Acosta Gomez, Jamie, if you prefer. I'm a practicing community pharmacist from Madrid in Spain. In fact, I'm in my own pharmacy now talking to you. And I'm also, I have the privilege now to be serving the FIP as professional secretary of the community pharmacy section. For this event, we are joined by a panel of fabulous speakers, and I wanted to sincerely thank each of them for taking the time to prepare the presentations and attend today's meeting, which is live in a not very convenient time for them. So, well, they are experiencing lack of sleep tonight. Thank you for being with us today, all of you. So some announcements, formal ones, before we move on to the contents. Please note that this event will be recorded, live streamed on FIP YouTube channel, and the recording will be available at events.fip.org. To all those listening, please feel free to send your questions through the Q&A box provided, and I will do my best to manage all the questions so that at the end we will be able to address them. You are more than welcome to provide feedback to webinars@fip.org, and I would like to take this opportunity to promote the benefits of membership with FIP, including events and webinars. FIP is the global body representing over 4 million pharmacists and pharmaceutical scientists. If you are a pharmacist or a pharmaceutical scientist and you would like to become a member, please register on FIP's website at fip.org. I cannot be happier of being an FIP member. I'm very sincere. It's very interesting. So today's program is first my welcome and introduction, which is the least important part, of course. We hope to have Dr. Erna Sif Arnadottir from Iceland, talking about the importance of sleep for optimal health and well-being. First, we had a slight change in the program today. Bing-Qian Su from the Shanghai Jiao Tong University School of Nursing, China. Sorry for my pronunciation. Her topic is raising awareness of quality sleep as an essential human function, World Sleep Day. After Dr. Su, we will have Dr. Sawisa Mohammad Noor from the Faculty of Pharmacy and Health Sciences from the University of Kuala Lumpur, Royal College of Medicine, Perak, Malaysia. I had the chance of attending a pharmacy conference in Kuala Lumpur not long ago, and it's a beautiful city. She will talk about the role of community pharmacists in the prevention and management of sleep disorders. Then we will have Dr. Julie Dofaidi from the University of Southern California Mann School of Pharmacy and Pharmaceutical Sciences from the United States. And her topic for today is the pharmacological and non-pharmacological approaches to insomnia. Then we will have Q&A time for you to have the privilege of interacting live with our very knowledgeable speakers. And then we'll have the wrap up and conclusion. So the learning objectives for today is to learn about the importance of sleep for optimal health and well-being, learn about how to raise people's awareness about the quality of the sleep, which I think is a very important topic, discuss and learn about the role of pharmacists in the prevention and management of sleep disorders, and also learn about how approach our patients and the pharmacological and non-pharmacological tools that they can use to improve insomnia. Our first speaker for today is Dr. Byung-Hyun Soo. Sorry again for my pronunciation. Dr. Soo received her PhD in nursing from the University of Illinois at Chicago. She was selected as a mentee by the ISRTP of the World Sleep Society. The long-term goal of Dr. Soo's research is to develop interventions to improve sleep in an effort to decrease the cardiometabolic risks associated with sleep disturbances and maximize the well-being of adults. Dr. Soo organized the World Sleep Day activity in 2021 and 2022, and her activities received the Distinguished Activity Award. Dr. Soo, thank you so much for being with us today. The floor is yours, please.
Thank you, Jimmy, for the wonderful introduction. Hi, everyone. Nice to meet you. It's really an honor to speak with you. I know most of you are pharmacists, so I'm speaking from a perspective of nurses. For some of you, you might don't know the World Sleep Day, so I'll just briefly introduce the background of this event. So it is organized by the World Sleep Society. Each Friday before the spring vernal equinox of each year. So for this year, it would be tomorrow. And its main aim is to build connections, because it is a good opportunity to kind of bring together all the people who are interested in to increase people's awareness of the importance of sleep. It's a very, very good opportunity to kind of connect people as well as raise people's awareness. Next slide, please. Okay. Oh, sorry, I need to enlarge this. So each year there is a different theme. So from the slide, you can see from 2008 until 2023, there has been 15 years that each year there are different theme. And for me and my team, we held two events. One is on 2021, which is regular sleep and healthy future. The other one is the last year, healthy sleep, sound mind, and happy world. And so there are two hosts. One is Dr. Han Fang from Peking University, and the other is Dr. Lourdes Del Russo from University of California. They are the two pioneers who helped to organize this event. Next slide. So I'll briefly introduce our experience. So for our event in 2021, well, we first prepared some pamphlets for handout to our audiences. Our target audience for that year is medical students, because we have a large medical university within our school, and for this students, they are going to be nurses, pharmacists, or doctors in the clinicals. So they will face a lot of sleep problems, but they don't know that they will have these sleep problems. So our aim was to increase their awareness. So we organized and created pamphlets based on current literature and evidence, trying to translate that evidence into practice, tell them about sleep hygiene, some basic function of sleep, and some consequences of sleep problems. Then our team also designed in early March, we designed the logo, and we printed the logo on the t-shirt and designed the prize, which includes coffee mugs and bookmarks and keychains to distribute that among the audience audiences as a way to attract the audience. Then we also created a video that tells people about the basic function about sleep and some common sleep problems they might face. Next slide. Then we designed some quizzes, although it's in Chinese. So the quizzes basically it tests people's knowledge about World Sleep Day and their knowledge about sleep. Then based on the test score, so we designed different levels of prizes. For instance, the first prize will win a mug, and the second will be a bookmark, and so on and so forth. So in mid-March, we designed our Twitter and our poster, which is the blue one, to tell people that we are going to hold this event. Then we have this banner, which is hang around our campus to tell people that we are going to hold an event on that day, which is March the 19th on 2021. Next slide. So here is our team. From this picture, you can see that most of our team members are students. They are undergraduate students and graduate students. And then here is the event on that day. Although it's raining, people are really enthusiastic about the event. So they are scanning the QR code, which contains the quizzes. And here on the table, there are small gifts as well as the prizes. And then on that day, we also combine our events with the other group. So those are the doctors. They offer free consultations to the students who are having sleep questions or sleep problems. Next slide. That based on our I think our activity on 2021 is very successful. So that inspired and encouraged us to continually hold the next year event. And so last year we similarly used built upon previous kind of experience. We used other new techniques. So for the first one, we called upon competition. From January to March, we called our students so that they submit a lot of work. The first picture is the video. They created the video, and the second one is the posters they created. And then during our later event, we actually used their video and poster as part of our activity. And click, please. And then next one. So then on March the 18th, because there is a lockdown, so we had to move our events from the in-person to online. So on the online Twitter, we share some knowledge or tips about healthy sleep. And next one. And then similarly, we designed our gift and the prize, which is the handbag and keychains and mugs. And then we also give these gifts to our audiences based on their degree of participation. Next slide. So for both years, because we use different kind of media and techniques to attract our audience, and we are very lucky that our activities and efforts were recognized by the World Sleep Society, and they awarded us this Distinguished Activity Award. I know from each year, there are approximately over 200 events each year, and there are 10 events will be selected as Distinguished Activity Awards. So we are very privileged to receive this award. Next slide. So based on those 2 years events, we had some thought. First is teamwork, because raising people's awareness is really a collective effort. From the World Sleep Society to our event, we involved, especially for us, we invited or involved our colleagues, including those who are working on a campaign, and we rented spaces from other departments. And we cannot do this without their support and help. And for me, I think the most valuable part is my students, because they are very talented. They have a lot of potentials. They use their skills to design the prizes and do the campaign, and also to hand out the pamphlets to the audiences and design some techniques to attract the audience. And another thing is public involvement, because we design some questions so that we will learn from them what we can do next year to improve our events. And so teamwork is really important for our both years events. The next thing is the external support, because I did not know World Sleep Day until 2021. I was in the ISRTP program. So Mike from World Sleep Society, he kind of recommended this event. And after he told us about this event, I was immediately attracted by this event. So along the way, they provided us with materials and other stuff to help us to hold this event. And then another support, help is corporates. I received a lot of support, or we got some sponsorship from Philips. They endorsed us with some gifts so that we handed out these gifts or distribute that to our audience, which is very important. And then the third thing is passion, because if we don't have passion for this kind of event, then it cannot succeed, because it really takes a lot of time from the preparation to hold the event to the afterwards kind of collecting our thoughts. It really takes a lot of time and energy. So those are the three things from these 2 years events we have kind of learned. And the next slide. So our continuing efforts. So this year, we are still planning to do some World Sleep Day activity. And for this year, we are going to do some interview with healthcare professionals, because the first 2 years we targeted medical students. And for this year, we are going to target healthcare professionals. For our institution, we have 13 affiliated hospitals with over 2,000 nurses only. We have over 2,000 nurses, not including other healthcare staff. So we have a huge amount of audience who will be benefit from this event. And then we are going to interview them so that they can share their concerns or their thoughts with their sleep problems. Similarly, we are going to do a sleep and me kind of storytelling. And then we are going to do some health education to share them with some tips about how to survive during shift work, some sleep related tips. And then we are going to do some scientific forum similar to this. Last year, we did some scientific forum regarding related to sleep, invited speakers from the United States, from Hong Kong, and also from Shanghai, which was very successful. So this year, we are still going to continue our efforts into this. So these are this year's plan. And next slide. So in the end, I'm really thankful for the efforts and support and help from the World Sleep Society, especially from Dr. Del Russo and from Mike. They really encouraged us to continue our efforts. And I especially want to thank my students, because I cannot have done this events without their help and without their support. Really improving people's awareness is important, but not a lot of people put that on their calendar. If as health professionals ourselves, we know if our awareness is increased, that's the kind of a priori. If we don't know, if we don't have awareness of the importance of sleep, then we cannot educate about our patients or about our clients about the importance of sleep. So with that, I will end our presentation. Thank you for your time.
Thank you, Dr. Su, for a wonderful presentation. We are going to share actually my pharmacy some materials tomorrow, also in our social media, to try to increase awareness of the people that we serve, and it's a very good excuse to talk about their sleep health. Thank you so much. So we move on now to our next speaker. I'd really like to warmly welcome her to the presentation, to the webinar today, Dr. Ernasif Arnadottir. Sorry again for my pronunciation. I did my very best. I'm sorry. She's an associate professor at the Department of Engineering and Department of Computer Science at Reykjavik University, Iceland, as well as the director of the Reykjavik University Sleep Institute and the secretary of the European Sleep Research Society. Dr. Arnadottir is the principal investigator of the Sleep Revolution, which received a 50 million euro grant from the EU Horizon 2020 Research and Innovation Program from the European Union. Thank you so much, Dr. Arnadottir, for being with us today. The floor is yours.
Thank you very much for inviting me. Yes, so thank you, Ines, for showing my slides. So what I wanted to focus on today is really the importance of sleep for optimal health and well-being. And so sleep is really one of the foundations of health. And I know you can take different things and say this is a pillar of health and this is a pillar of health, but I think without there's no doubt that these three, exercise, nutrition, and sleep, are really one of the major foundations of health and to maintain our well-being. And if you lose one of these, if you are not moving your body, if you are having poor nutrition or poor sleep, it will affect the other pillars as well. And the thing is, at the moment, most of us in our general education, we get very little knowledge about sleep. So for the general schooling, even for healthcare professionals, generally it's only maybe 1 or 2 hours or something that people are receiving on sleep. And I can imagine it's similar for you all as pharmacists in your that have learned at different institutions. So today we're really going to focus on the sleep as a pillar and how it affects these things as well as other health-related things. So next slide, please. So what is sleep really? We sleep 1/3 of our life, so let's hope it's not just a waste of time. And I don't really believe anybody thinks that still. We still are striving, though, that some people think that sleeping little, needing like only 4 or 5 hours of sleep, is that means you are a strong person and you can thrive and do things. But it's really as silly as saying that you can thrive without moving, or you can thrive and eat poor food, I believe. And it is really an active state of renewal and rebuilding. And we are seeing still very new research coming out, really what happens while we sleep. So we know it's an active state where we are producing proteins and other macromolecules that we're basically using up while we are awake. And as I will say to the general public, it's really just like plugging your phone in during the night for recharging. There's a lot of control of nerve synapses, so sleep is super important for memory. And in the recent years, we're also seeing that there is a whole system in the brain that is cleaning out waste material while we're all sleeping. So for Alzheimer and for other this type of degenerative diseases, many of the clear of waste is happening during sleep. So if you don't have good quality sleep, especially for deep sleep, then you will not get the same clearing. So I think there's a lot of research coming up in this area in the next few years. Most adults need 7 to 9 hours of sleep, and this is of course quite a broad range. But if we go to the next slide, then you can see, like here, if we take young adults and adults is there in a red box. So for 26 until 64, and then we start to look at older adults, which need a little bit less sleep. But 7 to 9 hours is a broad range. Some people are more on the range of 7, others at 9, but this is all considered recommended. And you may also be a long sleeper. So there are people out there who just require more sleep to feel rested when they wake up. And there are people who need less. They're so-called short sleepers. But the percentage of the population that is sleeping this little or this much, the percentage of them that are really physiologically long or short sleeper is much less than the people actually doing it. So we have like 1/4 of the population at any time is sleeping less than the recommended 7 hours, sleeping 5-6 hours on average. And these are not short sleepers physiologically. These are people who are really paying the price of this. And I will show you that in a little bit. If we move to the next one. So what happens during sleep? Not all sleep is made equal. So we have REM sleep, which REM stands for rapid eye movement, because while we are in this dream state, we are moving our eyes. Otherwise, we're actually paralyzed. So our voluntary muscle movement is not happening except for some small twitching. And this is about 25% of the night for adults. And this is especially important for memory. And one of the memory that we are really affecting in dream sleep is the memory that you are practicing movement, like you're throwing a ball, you're learning the piano, whatever type of movement. And you're practicing this during REM sleep. And this is actually why we have this paralysis of the skeletal muscles, because otherwise we would be acting out our dreams. And there are people with that disease, and that's quite problematic. Then we have the so-called non-REM sleep, basically all sleep that doesn't include rapid eye movements. And there we have 3 stages. Sleep stage 1 is really when you're in between sleep and wake. It's less than 5% of the night. So it's the time, you may be familiar with this, you're falling asleep on the sofa, and you start to drift off. You still hear what's going on, but you feel quite far away from it. So this is not restorative sleep per se, it's really just a gateway into proper sleep. Then we have sleep stage 2, which is the light sleep still. And then we have sleep stage 3 and what used to be called 4. Now most people have combined it into 3. And this is a really important sleep stage, which is this deep sleep. It's about 15 to 25% of the night in healthy adults. And if I would deprive you of sleep, just deep sleep, I would allow you to sleep for 8 hours, but I would always wake you up when you're going into deep sleep. You will feel very tired the next morning. And we see this is decreased in some diseases such as fibromyalgia. It's decreased in the elderly, dementia. It's also decreased when you give people hypnotics. So some of the medications that pharmacists are giving out are affecting this sleep stage. And others, such as some of the medication like for bipolar, for schizophrenia, they actually give people huge amount of deep sleep. And you would think that is good, but in reality, this means that people are actually really sleepy also the next day. So it's causing people a lot of problems with daytime sleepiness. If we move to the next one. Here you see how the sleep is divided across the night. So the first half of the night is really for sleep stage 3. So you have here the time from when you are awake, maybe 10-15 minutes, completely normal. If you're always awake more than 30 minutes, you may have some insomnia issues. Then you start off going into sleep stage 1, then sleep stage 2, and sleep stage 3. Stay there a while, and then at the end of this approximately 90 minutes, you get a little bit of dream sleep or REM. Then you have another cycle going back into deep sleep, up again. And you see here, if you cut it off by the 4 hours, first half of the night, there's quite a lot of deep sleep. And then in the second half of the night, you get much more of the REM sleep and lighter sleep. So if someone is having deep sleep in the second half of the night, this may be indicative of a sleep depth, poor sleep, or something of that nature. Next one, please. So what happens if we shorten sleep to 4 to 6 hours? So we do this in a laboratory to people who normally sleep longer. And what happens is that you get more hungry. So our brain is basically telling us that we need to eat. And it tells us that we need to eat more calories than we actually should. So we gain weight. The blood pressure increases. So our stress system, or the sympathetic system, is in overdrive. We get increased in insulin resistance. So even after just one night, 4 hours, you can see an increase in insulin, which is then a risk factor for type 2 diabetes. You get more inflammation, again, even just after one night, and the immune system is working more poorly. And finally, we have an increase in pain sensation. And this is, again, really interesting and something we need to explore further for everybody with a chronic pain condition, because it's not necessarily behaving the same way in people with pain conditions and then people with a healthy pain system who are then getting acute pain and have more acute pain reactions for one night. But we can see that we have this test that seems a bit strange, but you put somebody's hand into a bucket of ice cold water and you ask them to keep it as long in as they can really physically are able to do it. And people will be able to do it for a shorter amount of time when they're poorly slept. So there's really this, there can be a vicious cycle, sleeping poorly causing increased pain, and because you have increased pain, again, sleeping poorly. And then of course, sleepiness, moodiness, fatigue, etc. And this is, of course, this is healthy people that would normally not deprive themselves of sleep this way. But what happens if we move it, if we just ask people in the society who are sleeping less than 6 hours, how is their profile different from people who are sleeping the recommended 7 to 9 hours? And we do see an increased risk of obesity, hypertension, cardiovascular disease, type 2 diabetes, and actually death of any cause. So all of the things we see in the healthy people who are doing this for just science, and that it actually communicates well to society as well. So there may be a very few people there in between who actually are short sleepers, who wake up after the 6 hours feeling refreshed and are just not able to sleep anymore, but this is just a very small minority. Also, sleeping more than 9 hours is usually not beneficial, aside from these very few long sleepers. And this is quite often connected to people having chronic diseases, cancer, on a lot of medications, or something of that sort. So next one. Yeah, just the next slide, please. So what happens to our body if we sleep too little or poorly? And there is, I usually like to show this figure of a guy, because in some textbooks, it's still shown that sleep is only for the brain. And of course, sleep is really important for the brain, but sleep is also important for the whole body. All of our organs are affected by our sleep. So if we're not sleeping enough, or for some reason we have a poor sleep, for example, because of sleep disorders or because of a crying infant in your home, you actually increase the risk of accidental death because we're just not, our cognition is worse and our responses are worse. So we're more likely to have an accidental death. We're more likely to start yawning, and I probably shouldn't do this for 215 people watching on Zoom. But if you start yawning, talk about yawning, and think about yawning, you actually start to make people yawn. We start to have memory problems, hallucinations after some days. So it's really important for people with bipolar or schizophrenia. This can be really the way to get people into the mania part. So it's really important to think about their sleep. And eventually you will get micro sleeps. So this is a part of the accident risk when you're driving, that you will your brain just takes over and falls asleep. And then if we go again to the top, impaired brain activity, cognitive dysfunction, moodiness, depression, and accident prone. But the second half is then weakened immune system, more likely to get any cold or flu, type 2 diabetes risk, heart disease, high blood pressure, and weight gain. So it basically affects the whole body. Doesn't mean everything happens to everybody. In a similar way, we seem to be, some people are more resistant to particular parts of this, but this is having a poor effect on our body. We go to the next one. So with the appetite, it's not just that that we eat more, it's also that we make unhealthy choices. So we're less likely to be wanting to eat that broccoli when we are poorly slept, and we're more likely to want high sugar, anything that gives us a quick energy and a lot of caffeine, of course. So we don't necessarily make good choices when we're poorly slept. We go to the next one. And like I said, for accidents, and it's actually been known, like for Chernobyl, I don't know if you watched the shows, part of it is the hierarchical situation in that factory, but it was also that they were in a very poor shift schedule and were very tired when they were trying to deal with the accident happening at Chernobyl. Next one. So daytime sleepiness or excessive daytime sleepiness is quite common. You can just put down all the points, please. So we have a minimum of 1 out of every 10 in the general population at any time, which is dealing with or feeling excessively sleepy. But there are many different reasons that can be the reason behind this sleepiness. It can be because they're choosing to sleep for too little time or are unable to allow themselves to sleep more. It may be because of numerous sleep disorders, such as insomnia, which will be talked about later, and sleep apnea, which I will give you a couple of slides about. And it can also be the effect of other diseases and medication. So like I say, the hypnotics, which may help you to sleep, will not give you the same quality sleep, and such as the medication for depression, bipolar, schizophrenia, etc., they can also be affecting your daytime sleepiness a lot. And this is a huge quality of life issue for people to feel sleepy all the time. So it's definitely something we need to deal with. And it's often the reason for people like really sleeping with their device for sleep apnea is that they feel so much better during the day if they do this. So it's really a way to motivate people to take care of their sleep better, is that they feel better during daytime. We go to the next slide. Yes, and accident risk. So I wanted just to give a couple of minutes at the end for sleep apnea, because this is up to 1 billion adults are said to have sleep apnea at the moment, according to current diagnosis. I won't get into it, but we in the Sleep Revolution are working on actually changing the diagnostic criteria, because not everyone is feeling the similar way, the comorbidities, the symptoms, etc. But what is happening, and anyway, in any case, it is really common, and it's hugely undiagnosed in the society. So we have vast amount of people who have this and are untreated or undiagnosed. And what happens is that the airway keeps closing during the night. So you have these small periods of time where the airway is closing, the tongue is moving back, the airway is narrow for some reason. It can be because of obesity, the main risk factor for sleep apnea, but it can also be structural issues in the upper airway, which make the upper airway narrower than it should be. And then when we relax and the muscles are relaxing during sleep, then you get this closure of the upper airway. If we go to the next one. So yes, and here's a picture of someone with from my lab who is sleeping with a device to measure this. And it's typically just done for one night that people sleep with a device to measure their sleep apnea. So next one. So I have a small video that I hope will play. It's a snore video for you guys. I hope you will like it. Some people call me the snore lady. So I need to live up to that title. So what we see here is first we have position. So it says S. This means the person is lying on their back or supine. We have the activity, that the person is moving a bit in between where the blue line goes up. We have the audio volume up to 80 decibels. We have the flow. This is the cannula in the nose that measures the flow going in and out of the nose. And where it says OA or obstructive, this is when there's no breathing happening. Then we have in green, we have desaturations. The oxygen saturation should be well above 90, but here it's going down to 75 in some cases. And then we have the respiratory movements at the bottom, which should be in sync in the thorax and the abdomen. But when you have a closure of the upper airway, you don't see that. So if you can start the video, please. We are where the red line or the line is going. So here the person is not breathing. So you can imagine if you would do this for 30 times an hour, 60 times an hour, every night, how exhausted you would be the next day. Now they just started breathing again. And like I say, quite common. Okay, if we move to the next one. So this is typical severe sleep apnea. And what happens, sorry, this one is an Icelandic at the top, but this is the hypnogram again. This is a recording from one of my patients in a research study. And you can see that they're trying to get into deep sleep, here marked as sleep stage 3 and then sleep stage 4, but they don't really get to stay there because the deeper the sleep get, the more relaxed our muscles are. And then the person basically starts choking every time. And similarly in REM sleep, when again the muscles are very relaxed, it doesn't really get to stay there. So you can imagine how tired you would be the next day if this is your hypnogram or sleep quality for the night. Next one. So what happens, the symptoms of sleep apnea, you can just move all of the pointers down. During sleep, we mainly have respiratory cessation and snoring. There's no way to know this, of course, unless you have a recording or someone sleeping next to you. And then we have other symptoms. We have disturbed sleep. Some people, like 1/3, complain of nocturnal sweating, nocturia, or needing to go to the bathroom a lot during the night. And some people have gastroesophageal reflux because they're basically sucking up the stomach content during the night because of this drive to breathe the whole night. There's so much pressure inside the chest that you're taking up the content from the stomach. If you push next again. And during wake, as you can imagine, excessive sleepiness and fatigue. Not everybody is showing sleepiness as a symptom, which is amazing when you look at the hypnograms of these people. But especially for females, they're more likely to say they are fatigued, and not necessarily that they have an easy time falling asleep. This is something we need to explore further in the future. If you move to the next slide, please. What happens in sleep apnea, similar to the other, just for all sleep disorders, you're more likely to have hypertension, heart attack, stroke, memory loss, diabetes, even insomnia, because you're waking up in the middle of the night and you don't know why, depression, and daytime drowsiness or sleepiness. So all of the things that happen for poor sleep, and a really strong correlation to hypertension. So if someone has hypertension that is resistant, already on 3 medication, OSA is now in the guidelines that they should be checked for sleep apnea. So next one. So just to finalize, good sleep is vital for optimal health and well-being. I hope I have convinced you of this. And poor sleep or short sleep affects the whole body and the brain. The causes can be many, so it's really important to take good history with these patients and to really understand their problems so that you can put people into the right pathway for them to get the proper treatment and a better nighttime sleep for the future. For my last slide, just for fun, I have a picture of myself since I was 13 years old for the school magazine, and I was asked, what is the purpose of life? And I answered in Icelandic, but here in English, to have fun and sleep. So apparently I've always meant to be a sleep researcher since I was a kid. So thank you.
Thank you, Dr. Arnardóttir. I think that's a good phrase, have fun and sleep. Okay. So thank you for your presentation. As while I was listening to you, I was really thinking that it might be worth to start thinking of developing a service in my pharmacy to support patients with sleep disorders. And I'm also aware that in some countries, pharmacists support patients with sleep apnea, which is not a joke at all. Very serious thing, as you showed us. Also supporting them in the use of the CPAP breather device.
Exactly.
So yeah,
that's excellent. Yeah, I know in Australia that is a part of the pharmacist role to organize those machines. And for your interest for the sleep services, we are creating a new sleep questionnaire as a part of the Sleep Revolution project. And the idea is then it starts from the complaint. So anyone with a sleep complaint can answer that questionnaire and that we guide them in the right direction. So hopefully in a couple of years, when we have that validated, that can be used clinically for anyone who is interested in supporting their patients more. Thank you for sharing that. I think that pharmacist as the first place that many people go, especially if it's not, of course, a big illness, something that really needs to go to accident and emergency. We are open to people, and people feel confident, and the people trust us. And many times we are being asked about sleep disorders, so it might be worth, do it in a more structured way, following SOPs and registering what we do, and of course referring them to the right materials. Other healthcare professionals, if needed, supporting them with their pharmacological and non-pharmacological product that they are using. So I think that it's a very important problem that affects many people. Thank you for your presentation, Erna. It was very good. So time to move on now to our next speaker, Dr. Sawitsa Mohammad Noor. Again, sincere apologize for my pronunciation. Dr. Sawitsa is currently an associate professor at the Faculty of Pharmacy and Health Sciences at the University of Kuala Lumpur Royal College of Medicine, Perak, in Malaysia. And she is a registered pharmacist. She obtained her PhD from University of Queensland in Australia, and her interest is developing intervention and assessment to monitor and manage sleep disorders at community pharmacy settings. So this comes very timely after my previous comments. So thank you, Dr. Sawitsa. The floor is yours. Thank you so much.
Okay. Hi, good day. Thank you, everyone, for attending this event, and thank you, James, and thank you, FI, for the invitation. So as for introduction, I'm from Malaysia, as you know, and I'm a registered pharmacist as well as lecturers and teaching pharmacy student, and also teaching a Bachelor of Physiotherapy students as well. And today I'm here to share on the roles of community pharmacy in the prevention and management of sleep disorders, basically in the community settings. So just a bit on about sleep, as mentioned by Dr. Edna just now. So I just go quite fast on this part, just introduction. So as we all know that we spend about 1/3 of our life to sleep. So, and how is sleep is an active process? So because the brain's activity is actually not resting even during sleep, and no organs or regulatory system actually shuts down, although slight decrease may happen in the metabolic rates. And some brain activity increases during sleep, and many parts of the brain are as active as while we awake during sleep. And basically, we would have at least 2 hours of dream sleep per night, but sometimes we don't remember that we actually have sleep. And the most important part is some specific hormones actually increase during sleep. For example, the growth hormone. So this is why it's very important for the toddlers, the children, to have more sleep than adults, because they need to grow. And also melatonin also increase during sleep. Next slide, please. Okay, this one also have been discussed before. So as you can see here, that as compared to adults who need sleep about around 7.5 to 8 hours to function well, so the infants and toddlers need more sleep, and the duration of sleep actually will decrease. We need less sleep when we get older. And as you can see, pregnant women actually need more sleep as compared to those not pregnant. Next slide, please. Okay, now before we go to the next one, so basically the sleep deprivation is before we go to sleep disorder. So what is sleep deprivation? It is a condition that occurs if we don't get enough sleep. So why is that, or why we don't get enough sleep? So some symptoms that you can see when people have sleep deprivation, such as you have fatigue and mood changes, and also sort of like difficulty to concentrate when you do something, and you have memory problems, and even sometimes paranoid and hallucination can happen. So why is that? So the contributors to sleep deprivation is because sometimes people don't want to go to sleep, and some people, for example, they keep doing work and thinking that going to sleep will stop them from doing their work. So they would have inadequate time in bed. So because they think that they must be productive mentally, mentally that they must be productive. And the attitude that sleeping is lost or not necessary also would be one of the culprits, okay? And also there are some people with poor sleep hygiene. And of course, we're going to discuss on the sleep disorders. Just now we discussed already, but in this, my part is to discuss how this is to relate with the community pharmacy roles. Okay, next slide, please. Just a little bit on the contributors to sleep disorders. So basically, for example, in genetics, there are some disorders have established genetic basis. For example, what we call is fetal familial insomnia, and even in narcolepsy with cataplexy, and even in insomnia also quite common. And while aging, especially in women during menopausal, even pre-menopausal, we will have hot flashes and hormone changes that will actually disrupt the sleep because you don't feel comfortable. And 1/3 of older adults actually have insomnia. And basically, if we have more nocturnal awakening, so we will have more fitful sleep. And those overweight, those people who is overweight and also diabetic patient, they also have the risk to have sleep apnea. And people with pain, a certain pain, or having some illnesses like arthritis, osteoporosis, dementia, and whatnot. So, and also those with certain medications and in conditions where stress, depression, mental illness happen, also will contribute to sleep disorders, but not limited to this. We have more actually. Okay, next slide, please. So the common sleep disorders, this is just common. The common one, what I'm talking here, that we as community pharmacists, for example, that this is the common thing that we would see in community pharmacy as compared to clinical setting in the hospital. That would be more than this. But the common one that we see is sleep apnea and OSA, which is obstructive sleep apnea. And then insomnia, narcolepsy, restless leg syndrome, and actually it's over than 80 different disorders if you want to talk about sleep disorder. Okay, next slide. So now we come to the pharmacist role. So what is our role? Okay, the question is how can pharmacists help in the prevention and management of sleep disorders in the community. So basically, I would say from my experience from when I was studying in Australia and also the Malaysia case lah, okay, the Malaysian case. So in Malaysia, we still do not have a standard guideline basically, and how community pharmacies can intervene this issue is still in talk. So those with sleep disorders and mental health would basically go to psychiatrists if they want to, because sometimes people don't want to see the psychiatrist. So this is in the culture in Malaysia. So but if they go to psychiatrists, then patients have to wait quite a longer because the queue, the long list of patients in the clinic would be where patient need, sometimes they want sort of like to get help, but they have to wait. So this is the role of pharmacy should come. So how pharmacy can intervene as what we call is primary healthcare provider here. So in this case, pharmacists can actually play a role in many stages. For example, in prevention or in early detection of the risk to get sleep disorders. For example, in cases when individuals come to the pharmacy with signs and symptoms of sleep disorders based on the complaints. So as a pharmacist, what should we do? So in order to that, we need assessment tool for in such cases. So when we talk about assessment tools, basically we can have subjective measures or objective measures. So this we will discuss further later. And also, for example, patients already come to the pharmacy, so and then they keep coming to the pharmacy. So what are the things we have to do? Monitoring the roles as a pharmacist to monitor the situation, and in some parts and end of the day, we have to treat the patient, how to manage the condition. So in terms of treating, for example, in Malaysia cases, pharmacists have certain medications that community pharmacists cannot cannot dispense without prescription. So and we know that certain medications for sleep disorders need prescription. So those are the things that we have to look into in our country. So next slide, please. So when we talk about prevention and early detection, so as a community pharmacist, as we can do on the important parts is to educate the patient, to educate those who come to your pharmacy. So education can involve the importance of sleep, types of sleep disorders, signs and symptoms, how to recognize that, and on the sleep hygiene. And then the most important part is when they should get help. Okay, some people don't know when they should get help because many people think that issues with sleeping is not something serious, unless they know that actually sleep disorders may lead to other serious health condition, as discussed by Dr. Irma. So what a pharmacist can do, a simple way, you can provide a brochure, for example, posters or pamphlet. So in this digital world, so digital materials also can be provided. We can actually provide, for example, a digital sleep diary to the patient who complained about sleep disorders, where they can have it in their mobile phone and self-monitor the sleep. And then there are also some mobile phone apps available. And then we can also have sort of like having the on-site counseling when people come to the pharmacy, which can be provided as a value-added service in the pharmacy. And also when talking about early detection of issues, as a pharmacist, actually, we're talking about sleep disorders that we need to really know how to identify the signs and symptoms that patients have sleep disorders. And of course, sometimes they come to us as a pharmacist, undiagnosed yet, not yet. So they want to talk to someone, so they come with signs and symptoms. So in this case, we need screening tools. So this is the screening tools. So how do you want to use the screening tools? And as to the first aid, we have to think about, do we need to give pharmacological treatment or non-pharmacological treatment? So these are the things we need to really look into this matter. Okay, next. Next slide, please. Okay, this is just an example of pamphlet or brochure that we can actually provide at the pharmacy. So this can be in a conventional way, you provide in a sort of like brochure or pamphlet and give to the patient, or we can actually do it in a digital way where the patient can have it in their phone, or put it, we prepare as an apps, for example, so they can always refer to this one as an information. Okay, next one. Okay, now we come to screening tools. We talk about assessment. Okay, subjective measures. This is what we call subjective measures. So the screening tools, there are a few, quite a number of validated screening tools actually available and ready for use, where we can use it to identify or monitor the sleep disorders. But all we have to do is to use the correct tools to measure or assess the patient. For example, as you can see here, for sleep quality and daytime function, okay, you can use ESS, the Epworth Sleepiness Scale, or the Pittsburgh Sleep Quality Index. So this is widely used in research, but however, this is also applicable if to be used for as a community pharmacies, to be used in the pharmacy to screen the patient as well. And for example, we use ISI, insomnia severity index for insomnia, and for OSA and restless leg syndrome, we have, for example, the RLS scale and the MAPIS index to screen the patient. So why do we need to screen? Because we want to identify patient maybe not yet diagnosed, but we want to identify that whether the patient having the what we call sleep-related disorders, and maybe they are at least. Okay, next slide, please. Okay, when talking about subjective measures just now, actually there are also countries that have their own tools, and for example, in our own language, so that one also can be used. Okay, now we come to the objective measures. Okay, my study last time, when I was in Australia, we used Etigraph to monitor the patient. So Etigraph is one of the objective measures to identify the sleep pattern. So objective measures, meaning we identify the issue using an device or equipment to measure. So basically, in case like this, we can use both subjective and objective. So the measures will be like validating each other. So the common device that can be used, easy for community pharmacies, we can see is portable devices. For example, the Etigraph and the smartphone app sometimes also available. So just for introduction, the Etigraph is actually a wristwatch. Etigraph is sort of like a watch. It's a wristwatch. You can wear it all the time, and it can monitor the sleep pattern for a few weeks. So from the pattern, after a few weeks, we can identify the issues, whether the patient has, because from the pattern will show what is the issue, and usually parameters that can be observed from the Etigraph, things like sleep latency, sleep efficiency, as well as duration of sleep. And some apps in the smartphone also have this kind of parameters, although from my side as a researcher, maybe not as good as the Etigraph. And also there are also non-portable equipment. For example, the polysomnography, which is used in the lab. But as for community pharmacies, this kind of devices or equipment may not suitable because, for example, PhD polysomnography, we need trained lab technologists to handle the machine. So things like Etigraph and smartphone, we don't need a trained technologist to do that. Pharmacists can do that. Just need a screen and how to use it. So next. Okay, another one is monitoring. As community pharmacists, we can actually monitor. So we have patient, maybe undiagnosed patient with signs and symptoms come to the pharmacy. For example, we have patients who already met previously. So what we can do for monitoring is to follow up the previous intervention that we provided to them. and provide counseling when required. For example, talking about sleep hygiene, lifestyle, even diet and food, what's necessary to do to help with sleep. And so based on case-to-case basis, we can refer the patients, for example. And for diagnosed patients, sometimes the pharmacy also receive patients who already diagnosed with sleep disorders. So they came to the pharmacy just to talk about the side effects of the medication. And sometimes patients, because of the side effects, they want to stop the medication. So we as a pharmacist need to advise them what is the proper thing that they have to do and provide counseling when required. So that will actually help the patient to go through the condition. But this is not limited to this. So actually we can have more intervention as community pharmacists. Okay, next one. Okay, when we talk about treatment, because I come from Malaysia, so I'm not really sure from other countries because there are different regulations for different countries. So for example, in Malaysia, we community pharmacists can provide medication which are categorized as group C drugs, which is the pharmacies only medicines and over-the-counter supplements and herbal medications. So medication supplements like melatonin somehow can be used to help us sleep. And also, but when we talk about medicine for sleep disorders, basically it's in Malaysia is categorized in the A and B groups, which is under prescription drugs. So because we in Malaysia we do not have the dispensing rights where where hospital, clinics, and medical centers actually can have their own pharmacy there. So basically, patient who goes to hospital and clinics as well as medical centers, they can get the medication, especially the group A and B of the prescription from the hospital itself. So pharmacies will focus on the group C drugs and the rest. So what we currently doing, pharmacists in Malaysia currently looking forward to being in the process to develop standard intervention and management for mental health as well as sleep disorders. So the interventions may include pharmacological and non-pharmacological therapies, and also because of that, the most important part is to start training the community pharmacists before we do the intervention. Okay, next. Next slide, please. Okay, just to share, this is what I did when I was in Australia. So we actually this one published a few videos. So this was the project when I did in Australia. So the study actually developed a model of care to help those with sleep disorders when they choose to go to community pharmacy at the first place. So what I want to highlight here is that before we provide the intervention, actually the pharmacists and the pharmacy assistant from the pharmacists who involved in the study, we send them to training, a course provided by a sleep psychologist, where focusing on the use on the epigraph and sleep diaries, sleep skills, course assessment, and questionnaires. And so this is what we actually have to do. If we want the community pharmacists to actually go in deep to provide services for sleep disorders, for example, then training is actually needed. So next slide, please. Okay, this is another one. This is quite recent, published in 2021. So the discussion is very interesting to me. Where are we and where should we be going? We're talking about sleep health management in community pharmacy. So this is very interesting. So from this study, this is a review. So it was found that insomnia and the obstructive sleep apnea were the most frequently encountered sleep disorders in the community pharmacy. So the most common. And the 4 key points that we derive from the data, that can be derived from the data, is the preparedness of the community pharmacies. If you want to have services, for example, to provide service for sleep disorders, so are the pharmacists prepared? So what are the approach needed? And the capabilities of the community pharmacies, the facilities that we needed, and then what are the things that needs to change before we start the intervention. So these are the points that we need to focus. And from the study, it was found that community pharmacists actually reported that their sleep health knowledge was insufficient and emphasized the need for more education and training. And although some of them actually engaged in providing services for OSA patients, but none of the community pharmacists actually offered services for insomnia or other sleep disorders. So next slide. Okay, this is just to introduce what we do in Malaysia currently, very recent. So we have training modules for mental health, which includes sleep disorders. So this is done by the Malaysian Community Pharmacy Group. So the training namely community pharmacists as allies and responders in mental health care. Mental health, so there are 2 modules in training the community pharmacists. There are 2 modules. So the first module is the online, which is the 1-day course. And the second module will be a physical summit, which is a workshop type of training. So the modules will cover on the treatment part, on the adverse drug reaction and the side effects of the medication, as well as on the how to consult the patient, counsel the patient on the psychology part, as well as on their diet and food. So I think this is quite helpful. This is actually helpful for them to prepare the pharmacists, the community pharmacists, to go to the next step. Okay, next one. Okay, I found this article very interesting. This is very recent, which is written in the February 2023. So this is an opinion from Mr. Adrian Zecker, who is the CEO of the British Society of Pharmacy Sleep Services. So he said that now is the time for community pharmacy to help patients with sleep disorders. So looking at the increasing rate of sleep disorders, so this is the time to help patients with this ailment, which is now, what he meant is now. So the things that are interesting in the article I can highlight here is to expand the clinical role of the community pharmacist into helping people with suspected sleep disorders. This is very important. And then, do you need training? We don't need to go to sort of like doing diploma or master's degree, no. Things like CPD training with a few modules would be sufficient actually. And how can community pharmacists help? I mean, assessing the patient, question them to find out deeper understanding and follow the standard guideline if treatment is required. This is very important. You must have standard guideline to follow to help the patient. And to offer the services, pharmacists need to find time. And before that, to get knowledge before we offer the services. And in the current situation, the use of technology where possible to assess or monitor the patient. There are so many technologies can be used. And the most important part as community pharmacists is how to commercialize the service. Okay, this is very important. Okay, next one. Okay, this is the key messages from the sort of like the summary from me. But not limited to this. It's just a simple summary where this is very important actually as community pharmacists to our roles is first is in prevention and early detection before it goes the worsen the condition of the sleep disorders. So it's important for us to help the patient in preventing or in the early detection of the issue. And then monitoring part is also important. And management, if we will talk about first aid, how we're going to provide the first aid as a pharmacist, we need some sort of standard guideline or standard intervention to manage a patient with sleep disorders. And to provide services as part of the service in the community pharmacy, which is sort of like value-added service, for example, and how to provide it. So this is need a very good framework and intervention. And if we want to refer the patient, how we want to refer, to who we want to refer. So these are the things we need to look into. Next slide. Okay, that's all from me. Thank you.
Thank you, Dr. Zewisa, for an excellent presentation again. Yeah, you introduced us to what services, what community pharmacists can do related to sleep disorders. We had a question from Ilian Kraser from Israel. So yeah, I think it was answered. And I allowed myself to share an FIP report that contains also 2 services related to sleep disorders. One of them focused on the right use of benzodiazepines, which I think is a huge problem worldwide, how patients use these kinds of drugs, and the length of treatments not always aligned with evidence-based information. So thank you, Dr. Zewisa, for an excellent presentation again. Now it's turn for me to introduce you to Julie Ann Dufaidi. Dr. Dufaidi, again, apologize for my pronunciation, is a board-certified psychiatric pharmacist who provides clinical service for adults and youth with psychiatric illness at Los Angeles County and the University of Southern California Medical Center. Dr. Dufaidi regularly contributes to didactic sessions for residents and students on topics in psychopharmacology. Dr. Dufaidi has over 50 publications in peer-reviewed journals and textbooks. She served as president of the College of Psychiatric and Neurologic Pharmacists from 2013 to 2014, and received the SACLAC Award for Professional Distinction in Psychiatric Pharmacy. She has twice been invited to serve as a healthcare manpower development expert for the Ministry of Health in Singapore. She has also served as faculty for Tokyo College of Life Sciences. Thank you, Dr. Dufaidi. The floor is yours, please.
Thank you very much. I appreciate the opportunity to be here, and I have enjoyed the presentations previous to mine. Thank you so much. Now, next slide, please. So when we think of insomnia, think of it in a way as fever is to infection. So if someone comes up with a fever, they probably have some type of infection, and we have to figure out what's going on, what could be causing that infection. Well, if someone has a sleep complaint, we need to figure out what is causing that sleep complaint, do a little detective work as a pharmacist. So pharmacists in all settings, whether you're in a community, hospital, skilled nursing facility, consultant, really has a role in helping assess insomnia and helping patients with the appropriate treatment. So we want to ask the individual, are you having difficulty falling asleep or difficulty staying asleep? Everybody should be able to fall asleep within 30 minutes. In fact, if it takes longer than 20 minutes, you might be having some difficulty falling asleep. And it kind of depends on a person's level of sleep deprivation. If someone is sleep deprived because they've been studying all night, or they have been working too hard, they may fall asleep when their head hits the pillow. So we want to see if it takes longer than 30 minutes to fall asleep. That is one type of insomnia, and we want to recommend any kind of treatment that helps you fall asleep quickly. Difficulty maintaining sleep. Is the person waking up frequently? Now, this could be because they're taking their diuretic too close to bedtime and they're waking up to use the restroom. Or it could be because they have many worries going on in their head and that's waking them up. Or maybe they are over 65, over 75, and they just have lighter sleep. And that's okay. They may need a short nap during the day. So we want to really assess the sleep complaint. Early morning awakening may be a sign that the person could have depression. So poor quality, non-restorative sleep, we want to find out how is that person feeling the next day, because our goal is for the person to be functioning optimally the next day. I really agreed with Dr. Arna Dator regarding sleep being one of the foundations of good health. So how is insomnia characterized? Well, is it short term? That's several days to weeks. Could it be stressor related? Did the person just have a job change? Are they having financial stressors? Are they taking care of maybe a special needs child or a parent with dementia? And that could be contributing to their sleep problem. So we really want to look at all the problems that could be contributing to the sleep complaint and help solve those problems. As pharmacists, we are equipped to know which medicines worsen sleep complaints as well. For example, a person could be taking bupropion or Wellbutrin, which is an antidepressant that makes a person have trouble sleeping, or they could be taking a stimulant that could worsen their sleep. So finding out the cause of sleep complaint is really necessary. And how long has it been going on? Because we want to know if the person has chronic insomnia that may need more significant intervention. Next slide, please. So cognitive behavioral therapy. All of the national guidelines for sleep recommend cognitive behavioral therapy, excuse me, had eyelash in my eye, as first-line treatment for insomnia. So just sleep hygiene is not enough. We really have to look at stimulus control, sleep restriction, cognitive therapy, relaxation training. For example, making sure that the bedroom is quiet and dark and creating a positive association that when that person is in the bed, it is sleep time. So a person should not be working on their finances or taxes while they are in bed. And if they're laying there tossing and turning, they need to get out and maybe do some stretching or yoga or meditation or mindfulness practice before getting back into bed. And that's similar with sleep restriction, limits the time in bed to sleeping. Relaxation training can be very helpful as far as meditation, soft music, progressive muscle relaxation, guided imagery. All of these things can be helpful for improving sleep, and you can get a long-term fix. Next. Unfortunately, it takes 3 to 6 weeks for significant improvement. And if someone is really suffering with insomnia and is not getting their minimum of 6 hours, it can have an effect on their recovery from any of their chronic disease states. It can worsen their hypertension, diabetes, cancer. So we may need to give short-term medications, which I'll talk about in a minute. But let's see how effective CBT is according to the research. Next. 40 to 45% of patients actually achieve remission from their insomnia if they go through the cognitive behavioral therapy for insomnia, which is this multimodal approach. So this is what we really want to recommend. Next slide. And pharmacists can also be helpful in making sure patients know the pros and cons of self-treatment for sleep. For example, they may go to a pharmacy to get an antihistamine, a sedating antihistamine like diphenhydramine, chlorpheniramine, doxylamine can certainly help a person fall asleep in the short term. And so this can be good for someone who has difficulty falling asleep. It can even help a person stay asleep, but you can get some daytime hangover into the next day. And if someone is using an antihistamine every single night, then they can develop tolerance and it can stop working for them. We don't recommend antihistamines in people over 65, especially over 75, because of the cognitive impairing effects on memory. Hydroxyzine has less anticholinergic effect, it can be beneficial and may also help with anxiety. Melatonin is an evidence-based sleep remedy, particularly for seniors and for children that have trouble falling asleep. Children with developmental disabilities, autism spectrum, ADHD. This is an established treatment, giving melatonin 1 hour before bedtime can help reset the circadian rhythm. That is not necessarily the best treatment for chronic insomnia, but for children and for seniors and for circadian rhythm disruption, if a person is traveling and has jet lag, melatonin can be helpful to reset the clock. Valerian is a treatment that's widely used in Europe, and many may not be aware that it actually has activity at the benzodiazepine receptor. So if someone takes valerian for months and then they abruptly stop it, they can have withdrawal symptoms. Next slide. I'm going to move here from left to right to discuss prescription hypnotics by classification. Pharmacists are all familiar with the benzodiazepine receptor active agents, and I've listed the ones that are approved in the United States. Triazolam is really just to help put someone to sleep. It's very short acting and should not be used for more than 7 to 10 days because of rebound insomnia. If you take it and then take it for weeks and then stop taking it, the insomnia can even be worse. Temazepam can be helpful because it can also alleviate some anxiety that can help a person relax and sleep better. Temazepam can take 1 to 2 hours for the onset, but it can help a person maintain sleep as well. But there could be there may or may not be next day impairment. I rarely ever see the bottom 3 used, Estazolam, Quazolam, or Flurazepam. Next day impairment can be a problem. And I really recommend the benzodiazepine receptor active agents just short-term or PRN use because of the risk of dependence and next day impairment. Now, our Z hypnotics are non-benzodiazepine, but they still stimulate the benzodiazepine GABA chloride ionophore complex. So they actually facilitate gamma aminobutyric acid, which is our inhibitory neurotransmitter in the brain that calms overexcited areas of the brain. So both the benzodiazepine receptor agonists and the Z hypnotics work to facilitate GABA and help the brain shut down in order to go to sleep. Some of the advantages of the Z hypnotics is that they tend to work quickly within a half an hour, and the zolpidem and azapiclone can help a person stay asleep as well. More so azapiclone because it has more of the 3 to 6 hour half-life, whereas Zaloplan has only a 1 hour half-life, zolpidem 2.5 hour half-life. Now, interestingly, the Z hypnotics do not help with anxiety because they are selective for the alpha-1 benzodiazepine receptor. Now, many individuals who have trouble sleeping may also have a substance use disorder. They may have an alcohol use disorder, opiate use disorder, and in these cases, we would want to avoid the benzodiazepine receptor active agents and recommend a prescription hypnotic that does not have abuse potential, like trazodone or doxepin. So trazodone can help a person fall asleep within a half an hour, and it can help them stay asleep. The doxepin can take 1 to 2 hours for the onset, so it has a longer onset, and we use really low doses of doxepin. For example, 3 to 10 milligrams at bedtime. And then we have Vermeltion, that is a melatonin receptor agonist. And that is recommended for seniors that have trouble falling asleep. Our newest sleep medications are the dual orexin receptor antagonists. And so they block the wakefulness promoting center of the brain, the hypocretin center of the brain. And so the suvorexant, lemborexant, daridorexant, these are all agents that can help a person fall asleep and stay asleep. Next. So yes, so the doxepin and trazodone are commonly prescribed due to low abuse risk. The Vermeltion next. also doesn't have abuse risk, and it can help with sleep onset, but it may not help someone stay asleep. Now, we need to counsel someone if they're taking a DORA that they may need to have 7 to 8 hours left in the bed, because otherwise they're going to have next day impairment. Next slide. Patient counseling is essential for the best outcome, and this is an excellent role for pharmacists. So we want to encourage cognitive behavioral therapy for insomnia and encourage the lowest effective dose for the shortest duration of time. For example, females get a larger bioavailability or higher area under the curve when taking a Z hypnotic, and should always start on a 5 milligram of zolpidem or 5 milligram of Zaloplan and 1 milligram of isoprene. Taking the hypnotic on an empty stomach helps with a more rapid onset of effect because food delays absorption. And we always want to counsel on asking the individual to assess how they feel the next day after taking the hypnotic, so that they don't drive or work with knives in the kitchen and perhaps cut themselves if they're not as coordinated. We want to counsel on common and rare but serious side effects. For example, next day grogginess, loss of coordination, memory effects, particularly from the benzodiazepine receptor active agents, and rarely there can be hallucinations and complex sleep behavior. So if someone's never taken a hypnotic before, we need to say, well, rarely there is an effect where a person can be half asleep and talking on the phone, raiding the refrigerator, walking outside in the cold, and this could be dangerous. But fortunately, it's rare, and they can alert their bed partner to monitor them. Now, with the orexin receptor antagonist, there are some unique side effects where it can affect your muscle tone. They may have muscle weakness, and there's even rarely sleep paralysis or hallucinations as a person is waking up or falling asleep, and also rarely suicidal thoughts. The benzodiazepine receptor active agents and Z hypnotics are more well studied in individuals that have depression or anxiety or sleep or depression as safe adjuncts for individuals with those conditions. And we need more studies with the orexin receptor antagonists to see if they're really safe for individuals that have coexisting psychiatric diagnoses. Next slide. Now, I've developed this treatment algorithm that looks at assessment at the top in the gray boxes. We want to make sure that we're assessing someone's co-occurring conditions. And if sleep apnea is suspected, we want to recommend sleep lab referral. And hopefully they can go to Dr. Erna's lab and monitor their snoring as well. But it's really essential that we can make sure that someone's sleep apnea is corrected with a CPAP machine or weight loss or an appliance that can help with that. Because if we give a sedating hypnotic, it could interfere with the mini arousals that keep someone alive. If they have a history of substance use, we're going to avoid the hypnotics with abuse potential and recommend a recovery program. For psychiatric or medical diagnoses, we want to treat the insomnia concomitantly with depression, anxiety, bipolar disorder, or a psychotic disorder. Now, if the person has just difficulty falling asleep, maintaining sleep, early morning awakening, and we've ruled out these other conditions, we can consider a hypnotic over the short term, especially if CBTI is impractical. And hypnotic selection is based on if they have trouble falling asleep, maintaining sleep, or early morning awakening. And I believe I am almost out of time, so I'm going to let you look at this slide. Next slide, please. And I'd like to close with the pharmacist's role in the treatment of insomnia. We want to really recommend optimal assessment, educate patients and providers on appropriate non-drug treatment, and screen for causes of insomnia and drug interactions, and then counsel patients on hypnotic prescriptions on how to safely and effectively use their medication. Thank you very much.
Thank you, Dr. Dopadi, for another excellent presentation. I wasn't aware of the withdrawal symptoms from valerian, I must say. So I'll check into that and talk with my team, with my staff. Thank you for that. Yeah, we're out of time. We don't have sadly time for Q&A. My sincere apologies. So I would like to close this webinar by asking our very knowledgeable speakers to provide us with a very quick sentence. What do you think, what has been the most important part from your presentation? If I may start with you, Julie, if that's okay.
Yes, thank you very much. I think the most important part is that patient assessment is essential. What kind of insomnia, contributing factors, non-drug ways to help with sleep, but don't be afraid of the short-term use of hypnotics, because getting a person sleeping regularly and then implementing CBT can be a great strategy.
Okay, thank you. Dr. Arnaudottir, if you may provide us with a quick sentence.
I think for me, I'm really happy with all of the questions and the interest here. So I'm immediately thinking about what research we should do together, pharmacists and sleep. So okay. For me, that was the take-home message. I hope I gave you also some food for thought. Thank you.
Really. FIP is the right platform for that. We are a global organization reaching many pharmacists and many pharmacy organizations. So yeah, it's a very good suggestion.
I may be in touch.
Please
Thank
do.
You.
Dr. Sawisa, please, if you can provide us with a quick sentence, what do you think is most important from your presentation?
Okay, the most important part is I mean, depends on the countries where you living, you serving. So it's really important to have sort of a standard guideline or intervention on how community pharmacies can provide services. I'm not sure about other countries. Other countries may have the standard, but for Malaysia, for example, we still do not have that standard if you want to provide sleep disorders interventions or as part of the services in the community pharmacy. So we really have to work on that. So depends on how you want to develop that. That will be important part in this presentation.
Yeah. Well, thank you. I think this has been very interesting and important in terms of not only improving our knowledge as myself, but also raising awareness of this very important problem. So lastly, but not least, of course, Dr. Su, please, if you can provide us with a quick phrase.
Sure. I think the most important part is that you as pharmacists can play a critical role of identifying and treating patients with sleep problems. While you are prescribing medicines, please keep in mind that people may have sleep problems.
Yeah, of course. Let's have it high in our minds when talking with people. Yeah. So the recording of this episode will be made available on FIP.org. Please provide your feedback to webinars@FIP.org so FIP may continue to improve our digital event offerings. Visit events.fip.org for all future events. Registration and abstract submission for the next FIP World Congress in Brisbane, Australia is now open. Submit your abstract before 1 May and register before the 15th of June for the special early bird fee. And covering now, we would like to take this opportunity to stress the importance of what our colleagues in Pharmacy Education Journal are doing these times. The Pharmacy Education Journal can be found on the FIP website. And of course, last, a very special thank you to our speakers today. It's been a great webinar with lots of interest, very highly attended. Thank you very much. And also to you, practicing community pharmacists and pharmacists worldwide who are very busy, but still found 1 hour and a half of your very valuable time to attend this presentation. That speaks very well about you. So thank you so much. And this is bye-bye. Take care.